So these guidelines provide an easily accessible summary of the current evidence. As busy practitioners, sometimes we will not be as current with our literature review as we would like to be. At one point, personally, I was subscribing to, like, say, 5 journals. And after a while, I find that they are collecting dust because they come faster than I can read. Although the magazines are easy to read, your car magazine and whatnot, but journals are rather dry. So I tried putting them beside my bed. It just puts me to sleep faster. I put them in the toilet. Then you do your business a bit faster. So we need to make ourselves disciplined to constantly review the literature, and not everybody have the luxury of multiple subscription to many different journals. So we felt that having a guideline like this, where with the support of MOH, who provided us with, we do the literature review, literature search, and they help us to retrieve the actual full text article, so that we can read through everything and then summarize everything and analyze the data. Right. So that is a lot of work, and as Professor Singh said, it took us from the time that the committee was first formed to now is almost 3 years. Right. However, the guidelines are only useful if they are relevant. So if you come up with a set of guidelines about something which the majority of dentists do not do or do not use, then it just becomes just another book that's on the shelf. And I'm sure we all have enough of books on the shelf that will collect dust. So we want to do something which can be a ready resource to our day-to-day practice. And there are times that we think that we see a certain patient, we make out a treatment plan, and we wonder, is this the right plan for the patient? And how well supported is it by the evidence? And not many of us will have the time or the resources to go on a PubMed search, retrieve the full text articles, read it up, like maybe 5-10 papers before we formulate carry out a treatment plan. So we identify some of the things that may be controversial or may be a bit equivocal in terms of how dentists in Singapore practice them, and we review the literature and we come up with summary statements and make recommendations based on them. It has to be up to date because the evidence changes all the time or gets updated all the time. So the final draft of the guidelines was completed around, this is 2012, so about the middle of 2011, right? So these guidelines have not taken into consideration any new publications that has been available between mid-2011 to now. So some of these things may have, some other articles may have cropped up, but we have, I've gone through some of these papers, and there aren't a lot of major changes. It doesn't change the essence of what the evidence is out there, and so it doesn't change the essence of the recommendations that we're making in these guidelines. However, these guidelines should have an automatic expiry date, and general acceptance is roughly in the region of about 5 years. So it's hoped that in 5 years we can form another work group that can review the evidence again. It will not be as onerous as the first time, but we just need to update ourselves as to whether any of these guidelines or recommendations that we're making today becomes obsolete in 5 years. And it's for this reason that we have compulsory continuing education. If we depend on stuff that we learn when we are a student in school, then a lot of the things that what has been taught to us is already obsolete, and we'll be doing very outdated treatment for our patients. So guidelines likewise will need to be updated on a regular basis. And it's got to be realistic because you can, bearing in mind that a lot of these research were actually done at tertiary institutions by people who are already known to be experts in the field. So they have a certain standard of practice, and they do not have to practice within the constraint of, say, a general private practice. So we need to kind of like, when we make recommendations, to measure it against the realism of the recommendations that we're making. It cannot be some kind of ivory tower statement that can only be achieved by people working in tertiary referral centers. So at the back of our mind is that when we draft these guidelines, at the end of the day, when it's published, it needs to be something that will be adapted and adopted by the people that is going to practice them, namely everybody in this room and beyond, hopefully. So the process of guideline development is first there's a selection of the guideline topics. Within the college, we discuss a few other topics, but this topic on dental implant is, we felt at that time, is the most appropriate because it is, firstly, is increasing in prevalence. There are more and more people doing implants, as you can see from the various promotion by the different implant companies. And with the opening up of Medisave claims to all most dental clinics, the claims in terms of Medisave dental implant related procedures through Medisave is on the rise. And as if you have read the guideline, it's rising at a rate of like maybe between 10 and 20% every year, and that we're talking about big money, right? So Medisave being the national medical savings plan for the country, we want to make sure that there's got to be some evidence base in how we withdraw money in the kind of treatment that entitles us to dip our hands into the nation's Medisave account. And then once we decide on the topic, we've got to form the group. What kind of who do we want to be in the group? There are a lot of able people in the country, able as in people with the expertise, people with the knowledge, but you need to be able to match the next thing, which is willing. So you need to have able and willing people to spend the time to not just sit at the meetings. The meetings, we don't have a lot of meetings. Meetings are primarily just to make sure that everybody understands what each other is doing, and for some checks and balances. A lot of the work is done at home. There are, I think, for every topic that we research, that topic would have had at least anything between 10 and 100 papers to be reviewed, depending on which topic it is. So a topic like, say, the bisphosphonate-related osteonecrosis, there are less publications on it, so maybe there's slightly less paper to review, because we don't just we try to look at higher level evidence kind of papers. As compared with, say, a topic like immediate loading. You can have immediate loading, full arch, partial, single tooth, maxilla, mandible, anterior, posterior. So there are a lot of papers, and these are things that are very measurable, and that means that there are a lot more high quality papers that can be published from around that topic. So we do the systematic review. We tabulate the evidence out there, and then we once we have the evidence statements, and then we can make the recommendations. And after that, the first draft was circulated to various professional bodies. So if you see on the very first on your printouts, we sent it to Association of Oral Maxillofacial Surgeons, the Periodontist, Society of Periodontists, Prosthodontists, people who have who are stakeholders basically, who would also have an interest in improving the standards of implant dentistry. And we also sent it to the restructured hospitals, to the university as well, right? And we solicit feedback, and because sometimes when we keep staring at the same paper and the same statements for 2 years, after a while you fail to register any irregularities there. And in fact, just as a matter of example, I can give you is that in the handout that you have as you come in, the secretariat staff outside gave you a thick booklet which contains the entire set of guidelines and a summary version, right? Now the summary version, we have also looked at, or at least I myself have looked at it many times, and there's something that was missed out, and we will publish an errata on this, that in the last topic number 12 on immediate loading, you see a series of 6 statements, 6 recommendations. And if you were to read through them in the summary, it doesn't quite make sense. Because the first 2 statements, there should be a subheading as edentulous mandible.